long introduction and remarks like that, maybe I'd be well to stop here and call it a day. I really did appreciate that. I would like to say to the members and friends of the Central Surgical Association that I have really been honored to serve as your president this past year. I recall the surprise and pleasure. We could have the slides off, please. I recall the surprise and pleasure last year in Madison when it was announced that I would be the president. And I remember the sense of surprise and delight when Dr. Turnipseed and Dr. Vitale came out into the hall, into the auditorium, and escorted me to the podium where I was presented the gavel by Dr. Freed. So here I am, the 70th president of our association. I'm indeed humbled and in awe of the number of very talented people who have served in this position before. And I would certainly like to thank this year the council and the committee chairs for helping us and really doing all of the work in preparation for this meeting. In particular, our association really depends on our two professional association directors. I'm not sure if they're in the room, but I would definitely like to acknowledge Ms. Noni Lowry and Ms. Jill Kowalak, who are really the mainstay of our organization, and thank them so very, very much. Do they happen to be here? They're outside at the desk, but please thank them when you go by. In 2008, Dr. Chris Ellison, when he reported to you as president, he reported on the vital signs of regional surgical societies. As you know, most regional surgical societies are feeling the pressures, are feeling the pinch of changes in our society, changes in the economy, the impact of the recession, changing expectations of our younger surgeons. But I'm pleased to report to you today that this past year, the Central Surgical has had what I would think, on balance, is a very good year. In terms of abstracts received for this meeting, papers published, meeting attendance, and new members received this year, which you'll hear more about this afternoon. The Central Surgical, it goes without saying, is my home society. I really enjoy the stimulation that I receive here attending the scientific meetings, the fellowship, the camaraderie, the scientific debate, which has been on full display this morning after papers are presented, and the enduring friendships which one can develop here. I have first attended a Central Surgical meeting when it was held in Louisville in 1987. At that time, Dr. Larry Carey from The Ohio State University was the president, and then I joined the next year in 1988. Now I would like to acknowledge the love and support of my family, many of whom are here this morning. First, my wife Christine, my best friend, advisor, and loving wife for 41 years, soon to be 42 years. I would not be at the podium this morning without the support, the encouragement, and at times the critique which she has provided to me. And she's also been a faithful traveler following my career through Boston, Chicago, Germany, and now Louisville, and putting some of her own ambitions on hold. My daughter Ingrid and her husband Mark are here this morning, and my son Paul and grandson Jack, who arrived at 12:30 this morning, and then our son Carl. I would like to acknowledge Carl. He was with us at the President's Dinner on Wednesday evening. He's a professional musician, and so he's now on the road performing in Nashville and then moving on. At this point, I would like to move forward. Chris, that was the picture that you just had up there, please. Could you back up? I guess I can do that. Back up about 4 to yes. I'd like to acknowledge individuals, surgeons who have been very influential in my training. And first, I would like to single out Dr. Gerald. Dr. Gerald was professor of surgery, chief of the surgical service at Providence VA Hospital from 1968 to 1986. I worked there for 3 years in the 70s, and he was just a wonderful teacher, mentor, and really taught me the craft of surgery and good technique. Dr. Manick was my program chair at Boston University, and then also became a chair of surgery there. And I always respected him as a perfectionist, both in surgical technique and in his ability in insisting on running a very good residency program. Dr. Nehus was my fellowship director after residency at the University of Illinois. He introduced me to GI physiology along with Dr. Tom Bombeck. He introduced me and taught me how to perform GI endoscopy. And then he introduced me to the world of international fellowship and international friendships. Dr. Nehus, of course, was in many international societies, and we always had a stream of international visitors coming through. Locally at the University of Louisville, I would like to acknowledge Dr. David Richardson, who is in the audience today. As a longtime friend, I moved there in 1980. A role model as teacher and as an excellent clinician, a heart for training the broad-based surgeon, which we're going to hear about later on today and tomorrow in our meeting, and a real commitment to general surgery. And to Dr. Hiram Pope, who gave me my first job in 1980. He has always emphasized and been a role model for the importance of education, for teaching residents, but not only residents, even though he's chaired, the importance of teaching and setting up good training programs for our medical students. He is very committed to research, and he is also the one who really got me involved in Central Surgical in 2006 when he asked me to be the host. And then I'd like to give thanks to the faculty at the University of Louisville. Many of them are pictured here. In 2006 when Dr. Garrison gave the Yandell lecture. I would like to point out several colleagues with whom I work today. Dr. Vitale, who's up here, Dr. McCafferty, and Dr. Gar, with whom I really practice on a day-to-day basis, and I appreciate their input and assistance so much. Now, I've decided to talk to you today about the current issues surrounding the practice of general surgery. We all know these are changing times. When you are president-elect, it's not unusual to get advice from people, colleagues. You ought to talk about this, you ought to talk about that. One comment stuck with me, though, and that was last year in Madison, Dr. J. Roosevelt said, well, talk about something that you're passionate about, something that you can feel, have some feeling about. So I tucked that away, and from time to time, there are things on the floor and in the hospital that do get me stirred up a little bit. And most recently, it's been the electronic medical record. I have been dismayed and sometimes annoyed by the rising power, the increasing power of hospital administrators, insurance executives, and then the really excessive importance on productivity and RVUs. You know, aren't we worth more than our RVU value? But something I'm also passionate about, or I think is very important on the positive side, is just the tremendous ability, skill, and talent that we see in our young trainees and our residents. So that's important to me too. And But we know gloom and doom abides plenty in the hospital corridors. Shortage of doctors, less time for your patients, push to shorten length of stay. We are now providers, we are not doctors, we are not surgeons in the eyes of many. So we're practicing in changing times. And, but we also have, while we seem to be under some siege, under some threat, we certainly have many advantages when we practice day to day. We have wonderful hospitals, we have great operating rooms with tremendous lighting and monitors, we got all sorts of devices. We have unlimited access to information through the internet, cures for many diseases that were formerly considered incurable, such as the childhood leukemias, the rapid developments of endovascular surgery and the obvious advantages that seem to be holding up. So it could be in some ways we are also entering the best of times. Yet with the concerns and the positives, I do think for the individual surgeon there is a sense of uncertainty in the air, wondering about our fate in the next 10 years, wondering about our profession, and what it's going to be like to practice. So these issues have been addressed before at many meetings, in articles and opinion pages, but I'm going to focus on that this morning from the point of view of the individual surgeon. So many of the reviews in the past have looked at a more global impact, a more global effect on the profession, but I'm going to look more on what it means for the individual surgeon. And so the title of my talk is The Practice of Surgery in the Next Decade, and I'm going to try and persuade you by the end of the next 15 minutes that the future is still bright, albeit with the challenges out there and with alligators in the swamp.